A virus is hitting children hard all across the country, filling up pediatric hospital beds. Now we're starting to see a similar issue here in mid-Michigan. TV5's Lanita Brooks has more on how our local hospitals are combating the rise in RSV cases.
The local hospitals, 80% of the beds are occupied by children who have RSV.
But it's not just a local problem. Respiratory syncytial virus, RSV as it's called, cases have been on the rise across the country, pushing some hospitals to capacity. The CDC has reported a 500% increase in the percent of positive tests for RSV from early September.
All of the intensive care beds in the state of Michigan are currently occupied, along with the rest of our departments. So all of the children's hospitals around the state are seeing large volumes.
RSV starts out like a cold with symptoms such as runny nose, cough, and fever. Dr. Schneider says their worst season was the fall leading up to the pandemic, and that current RSV numbers mirror those numbers.
The volumes that we're seeing are pretty common for most respiratory seasons. They just tend to fluctuate every year depending on, what season. Every season's a little different, but there's quite a bit, and it's early this year.
Hamilton Community Health Network says parents should keep a close eye on their child's condition and contact their doctor if they begin to have trouble breathing, seem dehydrated, or their symptoms worsen over time. Local infectious disease specialist Dr. Nicholas Haddad contributes the rise to multiple factors.
Kids have not been exposed to RSV in the first part of the pandemic. Their mothers may not have been exposed to RSV and then did not develop immunity to pass on to their babies.
There is no vaccine to prevent RSV, only a medication for infants at high risk of developing severe disease, such as premature babies. But physicians encourage patients to get flu and COVID shots to lessen RSV symptoms if contracted. Reporting for WNEM TV5, I'm Lanita Brooks.
As mentioned, at this time, there is no RSV vaccine, but several companies are working on one with the hopes that it will be available within the next year.